and welcome back to Health Watch. We've been talking to Dr. Tony Tomtot about physiatry and particularly the role of acupuncture in your particular field. And we've kind of talked about the traditional things that other physiatrists and some pain management people can do and your approach to that. But your particular expertise and the one that you offer is uniquely is your acupuncture training and your background. You have certification in that. What did you have to do to get that certification? I mean, it's not universally available.
Right, exactly. This is very different training in the U.S. For us, we have to go through the training during the physical medicine rehab. Luckily, I have a lot of training during that 3-year period at Stanford. And after that, I went through another intensive course for 1 year at UCLA. And that's what I got the training from the physician medical acupuncture. And I got licensed in Pennsylvania. So I've been practicing for almost 10 years.
Right. And you know, in our culture, that's unique. But in other cultures, it's the modern way of
exactly.
treating.
As you know, I'm Asian American, and I grew up in Vietnam. And back home, when I remember, even when I was little, when I had a cold or flu, my parents always take me to the acupuncturist to do some of the acupuncture point to get rid of the pain. You know, when you have muscle ache from the virus infection, that's what we do. But here in America, we'll tend to pop pill. We take Tylenol, we had to take Advil. You know, we didn't think about the side effect. And I think that's the different approach with the Chinese about the pain management with acupuncture.
Right, yeah. Let's talk about the Chinese culture. It's been known for centuries.
Yeah, for 2,000 years or 3,000
really?
years, whatever they've been in the past. And as you can see that I brought the model with Mr. John Smith here with all of the lines and the points. And you can see that the Chinese medicine, they think your body have full of, we call a meridian. It's a channel with all the energy point. And certain meridian have a certain point here. And this acupuncture point has a different function. And with Chinese medicine, they think, let's put it that way. How do you think acupuncture works for pain management in Chinese medicine? They think that the whole body will full of meridian with the good flow of the energy. When you have a blockage of the energy, and that's how your body manifests the symptom. And the acupuncturists play a role, put the needle in a certain part of your body, will help to create a smooth flow of the energy. It's like a dam, a river, and once the imbalance of the flow of the energy will, you know, manifest the symptom. When you uncouple the blockage of the flow of the energy, everything goes smoothly, and that's how they think that works for pain management. But for us, a physician, we think when we put the needle in your body, we'll create some trauma, that we traumatize a certain body part. And that's how to stimulate your body to produce more anti-inflammatory cell. And the research indicated it helped the brain to stimulate endorphin and caffeine. That's your own chemical to help to control the pain. It's like when you exercise, you feel good because your body produces endorphin and caffeine. Sure. It's like you're taking narcotic, Vicodin, morphine, or Advil, Tylenol. These are the chemical you take from outside, but your body's produce your own chemical, and that's how we think acupuncture helps to stimulate all that.
We live in a society of evidence-based medicine now, and you always will get that. And I'll bring it up because I think it is one that despite the years and centuries it's been used in China, it's difficult to actually prove
correct
with a diagnostic study or even measurements that what you say is most of it is anecdotal. Right. Although great evidence of anecdotal, but that seems to be the break point in America anyway. Is skepticism about something if I can't measure it, it doesn't happen.
It doesn't happen. Like I can give you some good example. In Europe, acupuncture is well accepted in the medical community and everyone in Europe because only physicians trained with medical acupuncture can perform that, and they think that's part of the medical specialty in Europe. But in our country here, we have not get a good organization for that. We do have the American Academy of Medical Acupuncture. You can check online with full information. And also now at NIH, we have another department they call Complementary Alternative Medicine, and they would do a lot of research for medical acupuncture, and pain management is part of that project. Right. In the past, we don't have that organization. What it is because you know, FDA involved. We need to have all the double-blind procedure. I mean, all the different funding. You know, medical acupuncture, we don't have a lot of funding for that. With the drug, you have the pharmaceutical company to fund for all that. Yeah. So it creates some research, but then at the end, when you have a side effect, they pull it off the market.
Right.
So for us, we don't have that. But right now, hopefully in the future, we'll get more funding, we'll do more research. But it doesn't mean that it's not working at this point, because it's well organized in China and in Europe. And then here we need to do a little more research if the FDA will help to get it approved. And then hopefully Medicare will start covering some of the acupuncture for patients.
Talk maybe a little about some of the ones that I think there are some indications that in fact it is approved for, and I brought up hyperemesis gravidarum, which is a nausea and vomiting associated with pregnancy.
Correct.
Acupuncture works.
And then there is one really for osteoarthritis patient with the knee pain. That's the #1 that acupuncture worked really well. John Hopkins, they already did research, and they said it's part of the medical treatment for a patient with knee pain with osteoarthritis.
We replace them.
Exactly, here in this country we replace them. Or we do Synvis injection, we do steroid injection, we do all, but we forget about all. What it is, well, I try to talk to the patient, whatever we try to do for you to help to control the pain, but you need to do some exercise, you need to lose weight, you need to do some of that to help to prevent any flare-up.
Right. When you approach, say, a patient with osteoarthritis of the knee, what would be, give me a typical injection techniques that you would use on a patient like that?
For example, if the patient come up to see me where they have a lot of knee pain, they cannot walk, step because it hurt, and that's what I need to evaluate and make sure, is it just the knee or something else? Is it from the spine or a different structure around, or the muscle weakness? And if it's purely just the arthritic development of the osteoarthritis in the knee, we'll try to work along the sides of the knee joint, and we put all the needle along the sides of the acupuncture point around the knee area. And sometimes we use the electrical stimulation directly into the needle, and we use the infrared heat to stimulate the needle.
So the concept of that type of therapy was more towards even creating more of that so-called trauma to the area.
Exactly.
When just the needle injection itself.
Exactly.
That's kind of interesting.
Yeah, so like you said, when we put the needle in certain part of the knee area or the hip, and we traumatize the body part, and that's how to stimulate the body to produce an anti-inflammatory cell to help to get more healing that way.
Now we're going to talk about the needles and the like in our subsequent segment, but when you do that, is there any more pain than what you would have with the normal injection technique?
It depends on the patient. All the young male patients come up to me and they always have problem a little bit with the needle, because that's the typical male, young male. But female patient, they have no problem.
Really?
Yeah.
I wouldn't realize there was that difference.
Exactly.
Yeah.
So, and then sometimes when you put the needle in, certain point that you may feel the initial of the insertion of the skin to break through the skin, but after that the patient has no problem at all. A lot of patients nap during the procedure. Usually I do, after I put the needle, I hook up with the stimulation and put a special infrared heat there, either in the neck, the back, or the knee, or the shoulder, elbow, and the patient just lay flat for 15-20 minutes. And most of them nap during the whole procedure.
That's how long the usual injection technique, about 15-20 minutes?
Exactly.
So it has to last that long to get the response that you're looking for.
Exactly.
Can you, okay, we have to take a break, but I'm interested in here. I'm going to get right back to that point when we get back from this message.